Welcome to Senior Living Marketing Perspectives. I'm Debbie Howard, co-founder of Senior Living Smart, and today we're talking to Carlene Motto, who's the Chief Marketing Officer at Belmont Village. And Carlene and I go way back. We have served on advisory boards and roundtables and spoken at many industry conferences. So Carlene, it is a pleasure to have you on.
Thank you so much, Debbie.
So yeah, we're talking about this kind of crazy time we're in right now, and to put things in perspective, in the time frame that we're recording this podcast, we are still, under shelter in place, and it has pretty much rocked the industry and upended just about everything that we do and how we do it. And so, first of all, Carlene, how are you doing, and how are your communities doing?
Well, thank you so much, Debbie. As you know, I've been in the industry and in healthcare 25 plus years. And so I've lived through hurricanes, fires, earthquakes, flu season, but this one is extremely difficult and probably absolutely one of the hardest. This virus, as you know, has no boundaries. It does not discriminate. COVID-19 virus disproportionately, as you know, impacts the elderly. Those over the age of 80 and with chronic disease suffer the worst. This is our entire population. Our employees, especially on the front line, as you know, have some of the most challenging and difficult jobs before COVID, and now you add this on top of it, and it's been extremely challenging to watch. They come to work with a tremendous amount of fear. Many of them have been impacted by schools not being in session. What do I do with my children now that I have they're not in school? They have very little, daycare options. They're trying to keep themselves as safe as possible at home, but many of them do not have access to some of the things that we do in regards to basic cleaning supplies. Many of them are still taking public transportation to get to work, and many of them then have spouses that have been impacted by losing their jobs, which has been just, horrific to watch. My heart breaks for our residents and all the residents that we serve in this industry who are confined to their apartments, missing and separated from their families, missing their friends. They want to know, what about the ladies that I usually have, lunch with, dinner? How are they doing? And then personally, everyone has a personal aspect to this also. This was the first Easter that I didn't get to spend it with my mom, who's, almost 80 years old. And she asked me every day up until Easter, will we get together? It's been the same for our families in regards to just that separation. I've been humbled by our employees when you think about the commitment coming into work with so much stress, with so much fear. Our families have been incredible. The amount of letters, notes, emails that they're sending our employees of encouragement during this time has been so helpful to our teams. Many of them are dropping off food. They're dropping off supplies. They send in letters, and it's, please tell me how my mom's doing, but most importantly, how are you doing as the executive director? How's your team doing? What can I do for your team during this time? So they've had their kids writing letters. They've showed up and they've performed in our courtyards outside. They've showed up in Easter bunny costumes during Easter and walked around the exterior of the building to be able to at least have some joy for our residents. So again, employees have been incredible. Our families are unbelievable. Our residents are resilient. They're also amazing.
They are a resilient generation, aren't they?
I had one email that I received from one of our residents, and he was so cute. He said, Carlene, COVID is like World War III. I've been through World War II. You haven't, so let me know what you need. I can help.
That's perfect. That's just perfect. And so in the midst of all of that, protecting and reassuring staff and associates and supporting community teams and making sure that families are informed and residents are safe. On top of all that, you're also supposed to continue marketing and selling and ultimately driving the business as chief marketing officer, right? So
Absolutely.
absolutely. So things, things are different. We have to reimagine the way that we, interact with prospects. What's the right messaging? What are the right channels? How do we reevaluate those channels? So, I'd love to know from your perspective, um, you know, what's working and what's different, because we've really thrown out the playbook, right? So the playbook used to
Right.
be, you can't move anybody in who doesn't come into the community. I mean, that was an absolute unbreakable belief system. And so
Right.
everything, in the sales kind of process, after nurturing, at some point we knew we had to get face to face. We had to have people come for lunch, try the food, meet the team. Yeah, we had on-site events. The tour was certainly a pivotal part of the sales process. You can't move anybody in who hasn't toured. And yet here we are, right? We can't have visitors. We're sheltering in place. And so we have to really replace all of those face-to-face interactions and find a way to virtually, connect and still kind of move the business forward, if you will. So tell me, like, what's that like for you? What are you doing? What's working? And really, what have you learned?
Right. Well, what's interesting is, prior to COVID, we had to be creative because most of our prospects and our families didn't have landlines. Most people got rid of their landlines. Most of them were not picking up their phones because it was typically the IRS calling to tell you that you owed money or they were going to throw you in jail. So we spent a lot of time with our sales teams really getting creative in regards to texting, emailing, being quicker, faster with written communication. And now all of a sudden we're saying, stop the written communication. Now is an absolute perfect time because everybody's picking up the phone.
Yeah.
Everybody wants to talk. Everybody wants to connect. So with us, we've been really successful during this period of time with voice to voice. And if it's not voice to voice, it's face to face. So we are absolutely using technology. Even though the technology has been around, we have FaceTime on our iPhones, we have Zoom, we have WebInX, but we didn't utilize those tools with our prospective families in the way that we should have. And so right now we have families we are virtually showing our communities by FaceTime. We are virtually having family meetings with Zoom. We are having resident and family meetings via Zoom. We have now Zoom rooms, Zoom conferences, and they love it. So again, I think for us, you're able to build that trust and connection with families, and they're so appreciative. Our sales teams, especially the external, have really been impacted, as you know. They are not going out into the community. We're respecting social distancing. We're respecting stay at home. And we're also respecting our healthcare partners that we know now more than ever are really fighting the fight. I mean, they are on the front lines. So what our external sales teams have been doing is really, we're adding a piece to the website basically called Community Matters now more than ever. How do you continue to give back? How do you honor those first responders, healthcare partners working outside of our own community? So one, we're acknowledging the heroes that work for us internally, but all of those healthcare partners, they've been terrific. They're picking up the phone saying, do you need PPE? We can get you some masks. We can get you this. So I think one thing we know about this industry, and we've seen it, and that's why you and I have such a, professional and personal connection, is everybody wants to do what's right for the senior. They want to do what's right for their families. There's a lot of collaboration together. And I think more than ever, even during this fear and this anguish and sadness, there is this camaraderie that everybody has really come together that is beautiful to watch. So our external sales force are working now on virtual CEU presentations, virtual Zoom social hours, delivering bagels and coffee to the skilled nursing facility, and then getting on Zoom and having their cup of coffee separate like we're doing right now.
Yeah.
And it's working. Continuing to give back, I think more than ever during this time, and we see it all over us, is that when you give back, you receive a lot. So we're also looking at some of the charity work that we're doing, making masks for others that may need it. So our residents and our employees are taking part in things and really giving back to the community at large.
So it sounds like, although, there's certainly a lot of setbacks and challenges, it's also an opportunity just to get closer to, your community, your families. It sounds like that's something that maybe is on your list to continue, even
Well, I think,
after.
yeah, and I think that's one of the things that we've learned is that, you said this in the beginning, we all went into this with no playbook. Unfortunately, we now have a playbook, but in this playbook are some lessons learned that have to be part of our operating practices as we move forward. And I think one thing that we've learned through this, we set up a process called Heartline. And so those are for the communities that either have an employee or a family member that does test positive for COVID. We want to make sure that the families who have a lot of fear, a lot of just questions at that time, can talk to someone personally. So we set up a dedicated line for them. And what we've learned during this process is that there is so much about our families that we didn't know that now we're learning, and their connections and who they're connected to. So I know everybody is trying to be respectful and looking at how are you spending your art, your advertising dollars, how are you spending your digital spend, but it also gives you an opportunity to connect with your true loyal customers in a way like we've never done before.
Yeah, absolutely. So it's interesting, some of the, older techniques that, became ineffective when people stopped picking up their phone, and now they are picking up their phone. And you're able to have those conversations, which is so important. Are you also seeing that because you have this kind of captive audience at home, that even maybe some tactics like direct mail or advertising, although the messaging has to be different for sure, but maybe people are actually reading the newspaper and opening their mail, or are you kind of saving those dollars for, getting ready to reopen? And can you tell me a little bit about kind of looking at those channels?
So we've been respectful. We believe right now our opportunity is really to tell our story through the website. And I know that you guys, especially at Senior Living Smart, feel very strongly about those channels, about the messaging, about the blogs, about information, about content. So we've really built up, and again, COVID has really pushed us to jump into those even quicker than we were ready to. So we have a blog now on the website that we implemented during this time. Our direct mail advertising, we are really holding until later. We want to be respectful during this time when families are still unfortunately impacted by spouses losing a job, or there are some people that are waiting for their checks to come from the government. We don't want to overload them with a lot of things at home with mail. We want to make sure that, one, we're connecting live with the families. We're providing meals in the community. We're sending meals to some of our seniors that want to move into our communities but are not ready yet, or we're not prepared yet. So we want to make sure that we're still staying connected. We really are implementing a lot of strategies around the website. The other things that we have set up that have been new and different is, one, Belmont greetings. So on our website, our testimonial, so, when this lifts and when it's over, what's your messaging and point? A lot of our messaging is going to be around appreciation, about gratitude, about giving back, about, even through some of the darkest times, how as an organization you could come out stronger and better than you were before. And I think that those are some of the stories that we want to be able to share with our existing families. We want to be able to share with perspectives that may be considering Belmont Village for their loved one. We want to be able to share those things that we did during COVID that we think that is important for them to hear.
Yeah, absolutely. I think this is really the opportunity to kind of reposition, the brand. And, I look at this as kind of three stages of communication. Our first stage was crisis communication. And we were sending out letters and we were building COVID pages on the website and we were
Yeah,
connecting with families and we were going through protocols and we were updating our chat script. And, there were a million just crisis communication things. That's not really the fun part, but
yeah,
it's something that you kind of have to have in place. And now we're moving into really a trust building communication phase, I think.
yeah.
And it's for us, it's about how do we position all of our clients to be the number one go-to resource in their local market. That these guys are the ones that know every senior shopping hour. They know where the food banks are. They know where the testing sites are. I can go and I can get a list of restaurants that have to go and curbside. Like they are my lifeline for anything related to seniors and older adults. And we've done that very much. We have three
Yeah.
copywriters just cranking out information and content. And I think for the companies that are doing that and are kind of forward thinking and are supporting their community and that's their messaging, I think they're going to come out in a far better place because you would have built so much goodwill and kind of made those deposits in the little trust account of your community. So I think that's really, really important. Any other things that you guys are doing kind of in this trust building, resource phase of communication?
Well, I think one of the things that you mentioned, Deb, is that in the beginning it was a lot of crisis communication, and unfortunately for us, we found out this isn't a sprint; it's a marathon right now. So
Yep.
our communication in the beginning, when we were looking at more of the crisis component, there were elements that um, reaffirmed what we were doing that's so critical to our families. One, they want timely communication. They want frequent communication. They want transparency. And so I think that those elements through this process, to your point, I don't know if I see families going back and touring 6, 7, 8. I mean, 2 months ago, we had families saying, well, I looked at 9 senior living communities and then I decided on Belmont Village. I don't see that happening anymore. So
Yep.
developing that trust and that rapport and that, you are the resource, you are the, from a, education standpoint, all the things that you talk about in regards to content on your website is so critical. So those are the things that we've been connecting with also during this time is, again, not selling Belmont Village, but we are a resource. We are a trusted resource. And again, helping them maintain good nutrition in the home, helping them maintain exercise, ongoing education. There's a lot of universities now, they could take free classes. They weren't aware that those resources existed. So putting them in contact with those resources, I have full confidence that when, COVID is not in front of us, they're coming to Belmont. We've built that trust with them. We've built that loyalty. I don't see them going to 4 or 5 different places to look at competitors.
Yeah, that's awesome. I think that that's absolutely the right attitude. And, it's such a hard time, I think, because the media has, you know, they control the narrative right now, and the narrative around, seniors and senior housing, is focused on all the tragedy, and they've kind of rolled, assisted living into nursing homes. Part of me is glad that every news article that I see always refers to people as nursing homes rather than senior living, senior housing, assisted living. But I don't know that prospects necessarily can sort out the difference either. And so perhaps they've lumped us into this kind of bucket. So, how are you going to address that? I guess, as we're trying to pivot into maybe reopening messaging, right? So now our communication, sales, and marketing strategy has to be looking towards reopening, even though we don't have a date on a calendar right now. This is a time to prepare those campaigns, figure out what the messaging is, and how do we now control our own narrative, knowing that people have seen a lot of images that are really hard to watch. Even the ones that they think are uplifting, like showing somebody outside a window. I'm like, that's still very sad. So,
Right.
um,
Well,
so
well,
how
I
are
think,
you going to work through that?
I think like, again, what we talked about in the beginning, I think your website is your opportunity to control your story. I do think that I spent 10 years of my career in skilled nursing. It's a very difficult business. And I feel terrible for the stories that are coming out, because of many of those family members can't take care of someone that's on a ventilator at home, and they
Right.
need a nursing home. And so, I think that unfortunately the media has jumped onto the negative stories that are coming out of there. But when you look at some of these nursing homes, 500 beds, and, have 10 positive COVID cases. As I said earlier when we started, COVID does not discriminate. It has
Right.
no boundaries. So these communities can be doing all the right things, and still it creeps into the building. It also creeps into people's homes, and it has. And so I think that, through your website, you have an opportunity to work on the messaging. I think we have really good industry partners. I know Argentum and Asha and Kala are really working together to make sure that the strong stories do get out. Um, I could speak personally for my mom, as I said, who's, almost 80, and she'll kill me for saying it. But, we haven't been able to, be at her house, and, making sure that she's not savvy with the computer. She's not going to go on Amazon and order all of her, toiletries and supplies she needs. She doesn't know how to order food online. So she's very limited, and, even getting access to medication. My husband had a doctor's appointment this morning. It's now telemedicine. My mom would not figure that technology out. So I absolutely believe, senior living, assisted living, absolutely, even during these very, very dark times with COVID, is the right place to be, where you can still have interaction, you can have good nutrition, good health care, access to PPE, which my mom doesn't have right now in
Right.
her home.
Yeah, I'm in the same boat. My mom's home alone, and it's really stressful. And I'm wondering, as some of the other solutions kind of shut down, adult daycare shut down, senior centers are
Right.
shut down, some of those other outlets that might have provided some level of support and socialization and services, we don't shut down. So, we're
No.
still here, and we're still serving the residents. So it was interesting. I was having a conversation with Bill Jennings from site staff, and I said, "Hey, Bill, we're not seeing website traffic go down. Are you seeing chats go down?" And he said, "No, we're seeing the same level of chats. The conversations are somewhat different because people are using that as a communication channel to get information, but actually the conversions are going up." So
Mm,
I'm kind of thinking that, as we are now, weeks and potentially months into this, whether people are trying to care for a loved one within their home or trying to support them, from a distance and getting all of those supplies that you were just referencing, if the realization is coming that I really need to think about this, that maybe home is not the best place, once you start removing some of those support systems.
right. And I think even for us, when you look at, the doctor's appointments, I mean, they have not been able to go to the doctor. As I said, I doubt very many of them know how to set up a telemedicine, telehealth visit on their screen. So now there's a lot of, discussion around the hospitals are all COVID and that's all they're doing. But what about all this preventative health that's still so important, especially with our senior population? They still need to get their, blood glucose checked, and all the things related to cardiac diabetes that right now is being neglected in the home because they can't go to the doctor. The other piece is we started to hear from family members is that even on the private duty, private caregivers home health side, a lot of those agencies, the caregiver did not want to come into the home. They were afraid to go into the home. And a lot of the families didn't want necessarily a different person coming into the home every time. So that also limited some of that access on the home care side.
Yeah, so I guess the question is, is there a way to kind of reposition, senior living, kind of comparing it to some of the, of the other options, in a way that is, not, you can't be that direct and that salesy, but I think it is important, somewhere in our marketing messaging to say, we all went through this experience together. The difference is that our residents didn't worry about having a great meal and wonderful nutrition and someone to care for them and toilet paper and supply chains and
Right.
cleaning and things like that. So I think it's going to be interesting to watch as we pivot back to kind of coming back online and reopening to see how we as an industry are going to kind of retool some of our messaging and our value proposition. Because a lot of times, before we were just focused on, hospitality and socialization. And now it's kind of people aren't really thinking about maybe mom would be better in senior living for hospitality and socialization. It's about being safe and having everything that they
Absolutely.
need. So
Absolutely.
I'll be interested to watch, and we'll be watching Belmont Village, and you guys are always the leader in so many ways. And for the sales team, I guess your guys can't tell you they don't have time to make their call outs, and they can't reach anybody.
No, and I, again, and I, as you know, as a sales leader, obviously, I have great appreciation for all that they do. But now more than ever, even, I mean, the amount of people that are truly universal workers, flexing, doing things outside of their comfort level, everybody is pitching in any way that they can to be able to make sure that our residents are still staying engaged and healthy, and the families are able to see them and FaceTiming. So my sales team have picked up a lot of those elements in regards to keeping the resident and the family engaged. But you and I, Deb, we've done a lot of little talks over the years talking about overall occupancy as move-ins and move-outs. So right now, more than ever, our families have been so loyal about, this is where I do want mom. So working together, I think will only help all of us. I feel humbled when I watch every day. I get on the Zoom calls and I listen to the stories that they're sharing in regards to just the little things they're doing. One of our communities in Arizona, for Easter, they did an Easter parade. They thought, okay, we'll have maybe 15 families come and drive by and honk and wave and the
Right.
Easter bunny. 100 cars.
Wow.
100 cars showed up in the parking lot to celebrate. Yesterday, we had family members that showed up and delivered meals for 80 employees and then had care packages for them to go home so that they had cleaning supplies to make sure that when they went home, they could also take care of their own apartment or their space where they live. There's been heart-wrenching stories about employees that had to choose where they were going to live, because if they were working in a community with a positive case, maybe their roommate didn't want them coming back.
Right.
They don't have options with multiple homes or where to go or what to do. So I really applaud a lot of the companies that are out there really working hard to help heroes. Some of the hotel companies have stepped up and said, hey, if you are on the front line and you need a hotel stay, there's no charge. So we've also been trying to pull together resources like we do for our families, also for our employees, that they can take advantage of during this time. We have, one thing on the sales side is that we've been fortunate, unfortunately, with some of the hospitality companies that have really been impacted by this. We have picked up some tremendous associates that are coming from hospitality that have great training experience, great customer service, just wonderful people. So during this time even, yes, we're interviewing different. It's all virtual, but we're making hires with individuals that are coming from an industry that may not have considered senior living in the past. and they've been, wonderful additions to our team.
That's great. That's awesome. So if this ends up being, as we've heard, more seasonal or cyclical for some time until we can get that protection, how will you prepare differently, or what do you think if there is a second wave? That we need to have in place, because let's face it, we were kind of scrambling this time around. And even though we had some protocols in place for wildfires and hurricanes and tornadoes and everything like that, it certainly didn't go to the level that we are in now. So have you thought about like what worked, what didn't work? If there's a second wave, what will we do? What should we do differently, whether it's in the crisis communication, whether it's in the resource phase or in the messaging phase? Because I feel like we have to almost prepare that it's going to happen and have those things really buttoned up so that, we're ready.
Right. Well, I think like you said, I mean, for this, there was not a playbook, and unfortunately now we do have a playbook. We're still in the midst of it, so we really haven't been able to kind of take a breath and say, okay, what's working, what's not, because we're still every day going through some type of change that's occurring or potentially, coming. But what I would say is that one, we've learned that the communication element is so critical. Communicating with your residents, communicating with our families, communicating with our employees. So what we do know is that you have to beef up your communication. They want regular, ongoing messaging. There's no such thing as over communicating during a time like this. So whatever resources you need to redirect to make sure that you have adequate people available to handle that messaging, those updates. We've implemented now an executive director newsletter every week that we're updating families. We are updating the website with messaging. They want it. They expect it. We're making proactive phone calls to our employees so that if it is a community that has been impacted by COVID, we want the employees to hear it from us first. So we're making the phone call to the employee. We're allowing them to, one, express their concerns, express their fears, reassure them what we know that's important. I think one thing that has helped Belmont through this entire process is that 2018, I think the industry in general all were impacted by the flu. It was a tough flu season. 2019, we spent a lot of time with flu protocols. So we were educating our employees about if you have a flu symptom, please do not come into work. We were educating about good hand washing. We were educating about a lot of different things. The flu shot, how important it was to take the flu shot. And if you weren't going to get the flu shot, then you were going to wear a mask. So I think putting a lot of those protocols in place before COVID hit actually helped our teams, because we were talking about those things. We were talking about when the flu comes in the building. And as you know, there's a lot of deaths associated with the flu also, if it gets into in a building. So communication is really important. Appreciation for your teams. When you talk about what are some of the lessons learned or what have I learned from this? Yes, there are some lessons. One, again, the communication. You can never, communicate enough. I think we know it, but it's really important that you're transparent with your communication. Make sure it's timely. Even if it's something that really is painful to share, you have to share it. And your families want to know it, and they should hear it from you first. I've always known that in this business, truly what differentiates the good from the great are people. And so again, hire hard. Make sure you're hiring the really great people. Make sure you're loving them. Make sure they have the tools to do their jobs. Make sure you get out of their way when you need to get out of their way. And make sure you don't take them for granted now more than ever. So it reinforces everything that I've learned, how important, in real estate, it's location, location, location. In senior living, it's people, people, people. And our people every day are incredible. And again, that's what inspires me to keep going, because there's been some days where it's like, oh my gosh, I haven't gotten out of my pajamas. How am I going to get up again? And then all of a sudden I get an email from a family member that shares a wonderful story with me, or I hear something about an employee that is just unbelievable.
That's wonderful. I think we all just hope that, this brings us together. It strengthens, a lot of, new communication skills, new best practices. We have better relationships with our community, with our associate teams and families and residents, and that will be felt by prospects when the time comes to make that choice. And I think once the sales team can get back to doing what has historically worked, and they can start doing some of those on-site events that are so important, that's not all they'll have. They'll also have this whole new skill set of, I don't,
Absolutely.
I can do virtual tours, I can do FaceTime, I can do Zoom, I can do all of these other things, and still be successful and still connect. And the more channels that we have to connect, because at the end of the day, that's the most important thing that any of us do. So
Absolutely.
yeah, I'm certainly encouraged. Everything you've done is setting yourself up for good future success. And I appreciate you being on, Carlene, and sharing your senior living marketing perspectives.
Well, Deb, thanks so much for having me. I'm so happy to see you happy and healthy, and look forward to when we're together again.
Me too. I hope we'll see each other at an industry event very soon.
Absolutely. Thank you so much.
Thank
Bye-bye.
you. Bye.